Hey guys, this is Dr. Gonzalez. How's it going? Today we're going to talk about the following topics, and let's just go ahead and get started. Let's talk about the vertebral column. So the vertebral column is a very strong and flexible bony column that extends from the base of the skull, as you can see over here, superiorly and over to the pelvis inferiorly. It is composed of approximately 33 bones, and it is divided into 5 regions. In the upper 3 regions, there's gonna be movement. So when we say upper 3 regions, we mean the cervical, thoracic, and lumbar. And then the lower 2 regions, there's no movement. When we talk about lower regions, we talk about the sacrum and the coccyx. So as I said before, there are several vertebrae. We have the cervical vertebrae. These are 7 cervical vertebrae that you can see over here. This is C1, also known as atlas. This is C2, also known as axis. And then you got C3, 4, 5, 6, and 7. We also have thoracic, which consists of 12 vertebrae, starting with T1, all the way down to T2, 3, 4, 5, down to 12. We also have a lumbar area, which is 5 lumbar vertebrae, L1, 2, 3, 4, and 5. And we have the sacrum, which essentially consists of 5 sacral vertebrae that are fused with each other to form a single bone called the sacrum. And the same with the coccyx, the coccygeal bones. These are typically 4 rudimentary vertebrae from CO1 to CO4, which will fuse with each other to form a single bone known as the coccyx. Some of the general features of the vertebral column include the vertebral body, which is this part right here anteriorly, and it's shaped like a short cylinder, and it's located anteriorly. And there's also a vertebral arch, which is a bony arch that forms the posterior part of the vertebrae. So to find it, you're gonna have to find the lamina and the pedicles. So this area right here is what we call the vertebral arch. So both the vertebral body and the arch, they are enclosing an area where we have what we call the vertebral foramen. This is the area where it forms a vertebral canal, and the main contents of this canal is gonna be the spinal cord and its surrounding membranes, aka the meninges, and the roots of the spinal nerves. Now, this vertebral arch gives rise to 7 processes. First, we have a spinous processes, and this one projects posteriorly from the junction of the 2 laminas. So this is one lamina, this is another lamina right here. Then there's 2 transverse processes, which are these structures right here. These project laterally from the junction of the lamina and the pedicles. There's also 4 articular processes, 2 superior and 2 inferior. So these articular processes project superiorly and also inferiorly from the junction of the lamina and the pedicles. And they articulate with articular processes of the vertebrae above and below, forming a stack of vertebrae. And also remember that the spinous processes and transverse processes both will serve as levers, and they receive attachments of muscles and ligaments. The superposition of the vertebrae in an articulated spine will create an intervertebral foramina, which you can see right here. The intervertebral foramina transmit the spinal nerves out of the vertebral canal and also transmit blood vessels in and out of the vertebral canal. These spinal nerves can be compressed at the intervertebral foramina causing peripheral motor and or sensory problems. The boundaries of the intervertebral foramen includes superiorly the pedicles of the vertebra above, and inferiorly also the pedicle of the vertebra below. So that'll be, for example, this area and this area right here. The anterior boundary is going to be the intervertebral disc and small parts of the bodies of the vertebrae. Then the posterior boundary, it's going to be the inferior articular processes of the vertebra above and superior articular process of the vertebra below. So those processes, for example, include those right here. So on a side view, the vertebral column has 4 curvatures. There's going to be a cervical curvature, a thoracic curvature, a lumbar curvature, and a sacral curvature. You can also look at it from the most anterior part: cervical, thoracic, lumbar, and sacral. The primary curvatures, also known as kyphoses, will develop during the fetal period due to flexed fetal position. And these are going to be located in the thoracic regions and the sacral region. The secondary curvatures, also known as lordoses, begin to appear during the fetal period, but do not become obvious until infancy. So these are going to be located in the cervical region and the lumbar regions. And then the cervical curvature or lordosis becomes fully evident when an infant begins to raise its head while prone or to hold its head erect while sitting. Now let's go over some of the vertebrae in the column. We're going to start with the cervical vertebrae. These are very small cervical vertebrae compared to thoracic and lumbar vertebrae. And so they have different processes that are more specific to them. For example, we have the uncinate process, which is this right here, that structure. These are elevated lateral margins of the superior surface of the vertebral body. There's also transverse processes and its foramina. These are the foramina. So these foramen transversarium or transverse foramen are openings in the transverse processes that transmit the vertebral artery and accompanying the veins and a nerve plexus. Also, if you notice, the spinous processes, it's very short, and also it has this unusual bifid shape. In our vertebral column, we only have 2 special vertebrae that have their own specific name, and those are atlas, also known as C1, and axis, also known as C2. So atlas or C1, it's a atypical cervical vertebrae with no body and no spinous processes. So if we hide the others, you can see that it does not have body or a spinous processes. It has an anterior arch which is shorter, and it has a tubercle in the midline of its anterior surface, and it has a posterior arch which is longer, and it has a tubercle in the midline of its posterior surface and a groove for the vertebral artery immediately posterior to each lateral mass. Each lateral mass has 2 articular facets. This is the mass. The superior articular facet articulates with the occipital condyle of the skull, and it takes part in the atlanto-occipital joint. And the inferior articular facet articulates with a superior articular facet of C2, which takes part in the lateral atlanto-axial joint. Now for C2, this is also an atypical cervical vertebrae. And as you can see, it has a bony prominence that projects superiorly from the vertebral body. This is known as the dens. And it articulates with the facet on the anterior arch of the atlas at the median atlanto-axial joint. In the thoracic vertebrae, there are two facets. There's a superior articular facet and an inferior articular facet. The superior articular facet faces posteriorly and slightly superiorly and laterally. Meanwhile, the inferior articular facet faces anteriorly and slightly inferiorly and medially. Other processes include the spinous processes, transverse processes, transverse costal facets, superior costal facets, the body, an inferior notch, and inferior costal facets, and of course, the arch forming the vertebral foramen. Now the lumbar vertebrae, these are very large vertebrae, specifically because they have a large vertebral body with a kidney-shaped outline. They have a large and triangular vertebral foramen. The large rectangular spinous processes that projects straight and posteriorly, as you can see right there. It has no foramen transversarum or costal facets, and it has mammillary processes, which are small bony prominence located on the posterior aspect of the superior articular process. And it has accessory processes, which are small bony prominence located on the posterior aspect of the transverse processes near its origin from the vertebral arch. This lumbar vertebrae also has articular facets that are almost sagittally oriented. It has superior articular facets that are concave and face medially and slightly posteriorly. And it has inferior articular facets that are convex and face laterally and slightly anteriorly. The sacrum, it's formed by the fusion of 5 sacral vertebrae, and it forms most of the posterior wall of the pelvic cavity. It is wedge-shaped, and the upper end has a wider base, and the lower end is narrower. This is also known as the apex. The base articulates with L5, and the apex articulates with the coccyx. The anterior border of the base projects forward in the midline, also known as the promontory. There's also the ala of the sacrum. These are lateral parts of the base, one on each side of S1 body. There's also anterior sacral foramina, which transmit the ventral rami of S1 to S4 spinal nerves. And there's also posterior sacral foramina, which transmits the dorsal rami of S1 to S4 spinal nerves. The posterior surface of the sacrum has 5 ridges, 1 medial sacral crest, 2 intermediate sacral crests, and 2 lateral sacral crests. These are representing the tips of the transverse processes. The posterior sacral foramina are located between the intermediate and lateral sacral crest on each side. The lateral surface of the sacrum has an articular facet for the hip bone, one on each side, and this takes part on the sacroiliac joint. There's also a sacral tuberosity, which is an irregular area posterior to the auricular surface, which gives attachment to an interosseous sacroiliac ligament. The sacrum encloses the sacral canal, which ends inferiorly in the sacral hiatus, and the sacral cornua or horns are 2 bony prominences located on each side of the sacral hiatus. Last but not least is the coccyx. This structure is a small wedge-shaped bone formed by the fusion of 4 rudimentary coccygeal vertebrae, as I said before. It forms with the sacrum, the posterior wall of the pelvic cavity. The base is the upper end that articulates with the apex of the sacrum, and the apex is the lower end. The first coccygeal vertebra has rudimentary transverse and superior articular processes, and the latter ones are known as coccygeal cornua or horns. And don't forget to click on this video if you want to learn more about the information that we're discussing today. And that is it for today. Thank you for watching, and I'll see you in the next one. Bye.